Wow.
So, I mean, I am on systemic testosterone, systemic estradiol, systemic progesterone because I have a uterus, and then I'm on local medications. I put local DHA into my vagina, and the only compounded we will sometimes compound DHEA because the FDA version is very expensive, but it doesn't matter exactly how much DHA goes in, so it doesn't matter if it's not exactly the same, and that's why you worry about compounded products. You don't know what's in them. And then we do use a compounded testosterone and estradiol cream on the vestibule. And while you're not supposed to compound testosterone and cream because it layers, the amount of testosterone is so minuscule that it doesn't matter if it layers. But ladies, if your doctor is saying, I'm going to give you a pellet of testosterone, there is this one FDA-approved pellet, Testapel. The rest of them, we don't really know what's in them. If your doctor says, I'm going to have compounded testosterone, so you could just do one click out of a click container, which is how we do the compounded testosterone estradiol. The testosterone layers in the cream. That's why the FDA very specifically says, do not use testosterone in anything other than a gel or a solution, which is the way the topical testosterones are. Obviously, there are other testosterones for men, but since women need about 1/10 of a dose, we can't use the men's pills. You can use injection, but the injection is so small, it's difficult to do that. So that's why we really recommend the gel that's the easiest. But obviously, your doctor has to be comfortable with prescribing that, and you have to be comfortable with using it.
Yeah.
I think another myth is a gynecologist will tell you, they'll either tell you estradiol will turn into testosterone, which is wrong. The cascade goes the other way, starts with cholesterol, and it goes down to 21 carbons on testosterone and 19 for estradiol. It can't go backwards.
Okay.
So if your aromatase is working in your body, testosterone will naturally turn into estradiol. But as you age, it's not going to be enough. You need to add the estradiol.
Yeah.
But when the gynecologists and I don't mean all gynecologists, I have many friends who are very knowledgeable, but when physicians in general, or people in general say, well, we have far more estradiol in a woman's body than testosterone. Because if you look at the graphs, it's much higher for the estradiol. It's because it's in a different unit.
Yeah. Yeah.
If you put them in the same unit, we have 5 times the testosterone in our body than we have estradiol.
Yeah.
And most clinicians don't do that. So know that. So how would women know that? And so that's why in our practice, again, monitor to make sure that we're not giving excessive testosterone. That's part of what we do. And people say, I'm going to turn into a man. I tell people I've been on testosterone for almost 23 years. I was a first soprano when I started. I'm still a first soprano.